Number one hair transplant killer, and it's not what you think. Hair transplants are by and large really safe procedures to have done. If you go to a good clinic with good hygiene standards and good technicians, good practitioners, you shouldn't really have too many problems. But the one thing that can bring a hair transplant undone completely, infection. It's not talked about too often because it's not exactly the sexiest of things and it doesn't really help get likes and followers and posts and whatever else. But that's the reality. The number one thing that can bring a hair transplant undone is an infection after the transplant's taken place. So there's a few things you can do. First and foremost, some practitioners, some surgeons, some clinics recommend this: prophylactic antibiotics. That means prophylactic antibiotics. That means taking antibiotics before your procedure to ensure that you've got a little bit of a baseline antibiotic protection in your body, so that any infections that might come during the procedure or afterwards, you've got a little bit of protection too before you even go in. Then, any good clinic worth their salt is also going to prescribe you antibiotics after the procedure. Really important that you take those, because antibiotics cover the entire body. Now, your donor hair is at the back of your head. The transplanted hair is at the top of your head. Realistically, people get really carried away with taking care of this top of head and where all the new transplants are, and they're so worried about touching it and pulling it and things falling out. But 9 times out of 10, where people actually get their infection is not the top of the head, it's the back of the head in the donor area. And why that happens is because that's just more susceptible to contact, right? So you go to bed in your hotel after the transplant, you put your head on the pillow. You go to the airplane after the procedure to fly back home, and you put your head on a really nasty airplane headrest. All of those things are going to bring you into contact with various germs and microbacteria and organisms and all kinds of lovely things that can create infection. Now, even though the infection might be at the back of your head, it travels, right? So it'll affect all of your head, the rest of your body. You might feel crappy, but importantly, those transplanted hairs, those newly, freshly put in hairs that need all that blood flow and all that oxygen supply and all the good stuff to go to them, the nutrients, they're going to be affected by that infection in the back of the head or wherever else it might be. So, beforehand, prophylactic antibiotics, have a chat with your doctor, your practitioner, your dermatologist, whoever it might be. They might recommend that to you. After the transplant, absolutely you want to take some antibiotics, and that'll stave off any infections that you might have. But also wound care, making sure that you keep that donor area nice and clean just by washing it normally. Really, there's not much damage you can do to the donor area after the fact, so just give it a nice good wash, keep it clean. Same with the top of your hair in the transplanted area. Follow the protocol that your clinic's given you, keep it nice and clean, keep the infection away, and the success rate is going to be really high.